Good afternoon, everyone, and welcome to those of you joining us online for this very, very important and we hope informative discussion on face coverings. My name is Bukosi Dube. I'm a physician, public health physician, and I'm also a senior health advisor with Oregon Health Authority. Last week, Governor Keith Brown revised the statewide face covering guidance to require face coverings or face shields for employees in private offices, in addition to public office spaces. The guidance requires face coverings and face shields in public and private building hallways, bathrooms, elevators, lobbies, break rooms, and other common spaces. There are two exceptions. The first one being employees at individual workspaces or in meeting rooms where 6 feet distancing can be maintained. The second exception is brief removal of face coverings in situations where someone's identity needs to be confirmed for visual comparison, for example, at a bank or when interacting with law enforcement. I want to turn it over to Michael Wood with Oregon OSHA to talk a little more about the new guidance and the work that OSHA is doing around them.
Thank you, Bukosi. So my name is Michael Wood, and I'm the administrator of the Occupational Safety and Health Division of the Oregon Department of Consumer and Business Services. For obvious reasons, we tend to just say Oregon OSHA. We've been involved in fielding various complaints from concerned workers as well as members of the public related to COVID-19 since really early March. And in that time, we have received now more than 10,000 complaints regarding COVID-19. To give you a little bit of perspective, we receive about 2,000 complaints on all subjects in a typical year. So in 5 months, we've received 5 years worth of work when it comes to complaints. Absorbing and evaluating these complaints, we have online hazard reporting forms in both English and Spanish, has been really an all-hands-on-deck project for Oregon OSHA. It has strained us, it's strained our system, it's strained the staff, but I'm pleased that we've actually discovered that our overall process has been scalable to the staff. Both out of necessity and because it's appropriate when we're dealing with new and sometimes changing requirements, we've really focused on resolving as many of the complaints as possible without taking any formal enforcement action. We have resolved more than 60% of the complaints, either fully or tentatively, without any inspection. And that's because we've been able to go through what's expected. Sometimes we've clarified issues with the complainants. Sometimes we've clarified issues with the employers. Often we've been able to clarify what needs to be done and to talk about how it can be done. And really, we've only ended up looking at inspections in a very few cases. We have completed several dozen inspections related to COVID-19 complaints. 14 of those so far have resulted in citations that included violations and financial penalties. None of those that have been issued so far actually involve any of the facial covering mandates. Most of them were related to the various closure guidance and to enforcing social distancing in general. But there are 6 or 7 in process right now that I expect to be issued shortly that are likely to include violations related to facial covering. It's important to recognize that although we at Oregon OSHA take notice of and apply the guidance from the Oregon Health Authority, and we apply the directives from the governor in the various executive orders as it relates to worker exposure to the hazards of COVID-19, our enforcement activity during this pandemic relies entirely on our existing authority under the Oregon Safe Employment Act. And we're really bringing the same tools to bear that we use in any case where we're looking at a worker who is exposed to a safety and health risk. Right now, in our approach to COVID-19, any employer who comes into line with our expectations really has no risk of a citation. We'll engage with them before there's going to be an inspection using what we call the phone and fax process, but that's really more likely to be phone and email. The inspections really only occur in cases where we want to check to make sure that we've gotten a straight story, or more likely where a business has refused to engage, or frankly where the business has simply told us that they don't plan to comply. When it comes to the facial covering requirements, both the new requirements and the ones that have been around longer, it is our expectation that employers will comply. And that does mean making sure that customers and other guests to the workplace understand that facial coverings are required. And it means more than just posting signs. If they aren't prepared to wear a face covering, you need to politely draw their attention to the fact that they need to be, and that they really need to do that in order to receive service or in order to be served. If they have a health issue that prevents them from wearing a facial covering, you certainly should seek other ways of providing service, whether it's curbside delivery or providing them a face shield that for many people resolves the problem. But what you can't do is simply let them into the business without restriction, because they represent a potential hazard, not only to your other customers, but to you and your workers as well. So whenever somebody isn't prepared to do that, at some point, you need to be prepared to deny service. And we're not suggesting that you tackle somebody or force them out of the store because they're not prepared to wear a facial covering. We're suggesting that you handle it the same way you would whenever there's anyone in your workplace who refuses to abide by the rules to be there. If a person came in smoking and refused to put the cigarette out, we assume that you'd refuse them service. And if they refuse to leave, that you'd address it the same way you always would when it comes to trespass issues. It's been our experience throughout this that employers and businesses in Oregon are prepared to meet this particular challenge that we all face. And the vast majority of people in the state are supporting those businesses in their effort to do so. But we have, as I said, needed to issue some citations. In the cases that we've issued so far, for those that were not willful, the total penalties ranged from $100 up to $2,000. And the $2,000 penalty was actually a pretty large employer. Now, we have issued 4 willful violations. Those penalties ranged from $8,900 to $15,000. But keep in mind, those are employers who made it clear that they weren't complying and did not intend to comply. And that's why we had to use our more significant enforcement tools. I want to point out that we also offer non-enforcement services as well. We'll provide free confidential consultation services for an employer who wants to improve workplace health and safety. Those services include virtual consultation services specific to COVID-19. There are a large variety of resources on our webpage that's specifically devoted to COVID-19, and the link is displayed for all of you. Finally, before we go on to the questions, I do want to mention that we proposed a temporary rule at the beginning of this week. It's designed to continue to combat the spread of coronavirus in all workplaces. It's a proposal. We're taking comments on it through the end of the month. And it's important to recognize that this doesn't, for most businesses, represent a dramatic change in what's expected of them. It's actually consistent with the guidance that's been issued from the Oregon Health Authority and in other contexts. What it's an attempt to do is move us a little bit in the direction of normal business so that employers are enforcing workplace safety and health rules adopted under the Oregon Safe Employment Act. We think it will provide greater clarity and consistency and predictability for both employers and their workers, and we think that that is important. It would also, to some degree, make our own enforcement activity more straightforward. So that really gives you a sense of where we are in our COVID-19 activity, and I guess I'll hand this back to Bakosi.
Oh, Michael, you guys have been really busy. That's 5 years worth of work in 5 months. That is impressive. Kudos to you guys.
Thank you. I've got some very hardworking staff.
So, although we've seen a leveling off of daily cases in recent weeks, our situation is better than most states. But COVID-19 is still active in our community and it's spreading at a rapid pace. We should continue practicing COVID protective behaviors, and some of these include ensuring that you maintain 6 feet of distance between individuals who are not of the same family or cohort, wearing face coverings or face masks, face shields when physical distancing is not possible, avoid large gatherings. Remember, outdoors is better than indoors, and of course, good and thorough frequent hand washing. We strongly recommend the wearing of face coverings because we know that people spread COVID-19 through droplets when they laugh, sneeze, and talk. Face coverings help contain the droplets. And because you can spread COVID-19 without knowing that you're infected and still not showing symptoms, it's important to ensure that you wear a mask or face covering when you cannot maintain physical distancing of at least 6 feet. I think you may recall Dr. Seidlinger saying that wearing a face covering, or a face shield is selfish in that you're protecting yourself, and caring in that you're protecting your loved ones. We've heard some concerns loud and clear, and we sympathize with people who are expressing these safety concerns regarding wearing face coverings. I want to assure you that as a public health physician, as a practicing clinician, wearing a face covering is very safe and does not pose a health risk. This means that your face is, so there's some things that you need to do to ensure that the face covering is worn properly. Make sure that when you're wearing a mask, it's tight above the nose, above your nose, and it's tight underneath your chin. This will ensure that no droplets. This will ensure that no droplets are coming out, and you must also ensure that you're able to breathe while you're wearing the mask. There are a variety of face coverings, and some include homemade cloth face coverings, like scarves, bandanas, and you can go on our website and see the different types of masks that are available out there. Thank you very much for tuning into this informative Facebook Live event. We want to focus we want to take as many questions as possible, and we want to focus primarily on face covering questions. So we will not be taking all COVID-19 questions. So there's a question from Liana. Why aren't face coverings required in common areas of residential buildings? Michael, you want to take that?
Well, typically that's going to involve exposure that isn't actually workplace exposure, so we wouldn't necessarily navigate that. But common areas of residential buildings typically, I think, would be public spaces. And so I believe that under the OHA guidance, they should be worn. And I actually think that they're required it might be difficult for us at Oregon OSHA to enforce that requirement because of the lack of worker exposure.
I like your response because it highlights that face coverings are important in common areas where you may encounter other people and have an increased risk of spreading COVID-19.
So the second question is from John, asking if face coverings or face shields for employees are now required to be worn in all private office spaces. And I'll go ahead and take this one. Essentially, yes. The only time that they wouldn't be required is when you're seated at your desk or seated in a conference room and you can reliably maintain more than 6 feet of separation. So the question does sometimes come up, well, what if I'm the only person in the building or the only person in the office? In that circumstance, obviously, you've got 6 feet distance of being maintained, so you wouldn't have to wear a facial covering. But in general, they're required in offices just like they're required in other settings.
So the next question is from Tom. Can a face shield do anything without a mask? That is a very good question, Tom. We have been talking about this for a while now as an organization, OHA and the CDC as well. So face shields, yes, are an acceptable alternative to masks. I want to emphasize that there's new evidence showing that they may not be as effective as face masks, but they are an acceptable alternative to face masks in people who cannot wear face masks. So I'm thinking of in a situation like we're in right now, where to be able to provide sign language translating, it will be ideal for us to not wear face masks so that people can read our lips as well. Or in early learning education setting, where kids rely on learning facial expressions and ensuring that teachers can clearly and easily communicate with young kids.
So the next question is from Mara asking, why don't you address my town's grocer allowing shoppers in, I think that's probably without masks, and posted signs saying that there are exemptions. Well, the truth is we've addressed a lot of grocers in exactly that situation. As I mentioned, we have received more than 10,000 complaints, and our response may not always be as quick as we would like, but we will address that if that is raised with us as a complaint. And we'll reach out to that grocer. We'll seek to get a resolution in the process that I described earlier. Just last week, we hung a red warning notice in an establishment where they weren't wearing face coverings and they weren't requiring their customers to follow the guidance, and they indicated that they weren't planning to. So we will address it. We are a little bit strained in our capacity to get out on site as quickly as we might like.
The next question is from Patty. What coverings are best? So there are numerous face coverings and shields available out there. Any face covering is better than nothing at all, as this would protect against spreading droplets. Sorry, go ahead.
No, go ahead.
So the most important thing to highlight here is that wearing a face covering or face shield is very, very, very important in decreasing the spread of COVID-19.
So the next question from Elin or Ellen is that it's my understanding that we should wear a facial covering and maintain at least 6 feet of physical distance Is that correct? It's not either or. Do you want to go ahead and take that one?
I would be glad to do that. So yes, it's a matter of risk, managing risks, and trying to lower your risks as much as possible. So if you can wear a face shield, a face covering, and maintain 6 feet distance, the better. So it's not either or, it's both.
From an enforcement standpoint, if you can reliably maintain 6 feet distance, then you're relieved of the requirement to have facial coverings on. But it's important to recognize that that's why in retail environments, office environments, and many environments, there's a recognition, an assumption that there are frequently times where you can't maintain that. When you're going down the hall or when you're stepping into an elevator, you don't control the person you're meeting or the next person to step into the elevator. So everybody should be wearing facial coverings and is expected to wear facial coverings in that situation. But really, anytime you've got 2 individuals in a room, it's a good idea to have the facial coverings on.
Thank you for that. The next question is from Devin. What if there is not 6 feet of space between workers, but there's a physical barrier like a plexiglass or a cubicle wall? Would you like to take that?
So I'll take that one. That's actually been the subject of a lot of ongoing discussion. First of all, let me say that it's probably clear that a typical cubicle wall isn't going to be high enough to resolve the issue if the desks aren't separated by at least 6 feet. And certainly there are concerns over the potential for aerosol spread that has resulted in some back and forth discussions between us at Oregon OSHA and our colleagues at OHA about exactly when a robust barrier like a plexiglass wall that's fairly good sized and substantial is large enough to substitute for distance and to substitute for the facial coverings. We actually put some language in our draft rule that tries to navigate that issue, and this isn't something that the state has officially adopted yet. But our proposal, explained most simply, is that if 2 individuals can have either end of a 6-foot string in their mouth, they're too close together once you've gone around the barrier. So the idea is that you need to have a large barrier that really substitutes for the distance, not the small 2-foot by 3-foot shield that you may see at a pharmacy.
So it's also very important to highlight that this is primarily droplet. It's a primarily droplet transmitted disease. However, there is a role for aerosolization transmission mechanism, in that in small offices with poor ventilation, small spaces with poor ventilation, you're going to see aerosolization playing a part in the spread of the disease.
So I think it's my turn to read the question. The next question is from Krista, who says, TriMet has reported that though they are only informing passengers that masks are available and not enforcing the mandate, they're saying that OHA has confirmed they're doing enough and meeting the requirement. Is this accurate? I guess either one of us can say no, that's not accurate. You need to do more than simply inform people, and that's true of retail establishments. It's also true of transit.
Yeah, it's very, very important that people in settings like that, employees in settings like that, are at the forefront of enforcing this mandate. A question from Jamie: where can I report a business that's not following the mandatory guidelines around face coverings?
Well, so the simplest thing is, I think that we'll display here in a moment the Oregon OSHA website, which has a complaint page. We do take complaints by email and by telephone, but it is best actually if you go to that complaint page. It handles our time more efficiently and actually allows us to make sure that we get the details we need. You do not have to give your name, but we actually prefer that you give your name, and if you want your identity protected, that you let us know that. That means we can follow up with you either to get additional information or to let you know on the resolution of the issue.
Question from Kathleen. Are face coverings with valves as effective or as safe as those without? So the reason we wear face coverings, face shields, is for source control. Yes, there is some evidence to show that it also, some emerging evidence showing that it's protective for the wearer as well, as per my comments from Dr. Seidlinger earlier. However, face masks with valves don't control the droplets that you're breathing out. So they may protect you, but they're not necessarily protecting others if you have COVID-19. So the ideal situation is not to wear face coverings with valves.
With a valve.
Yes.
And the most common valve that a lot of folks see out there is actually on an N95 respirator. And for the protection of the wearer, having the valve is just as protective as having the mask without the valve. But it doesn't serve the function of source control, of controlling the individual and preventing you from spreading droplets to others nearly as well. So the next question is from Sheila asking, how safe are face shields? It seems like when someone sneezes, it wouldn't be very effective.
So as stated previously, face shields are an acceptable alternative to face coverings, especially if they go past long enough to cover your mouth and wrap around your ears. That ensures that there is effective source control. But it's very, very, I'll highlight this again. We, the OHA and I believe the CDC are stating that face coverings are the main primary source of source control, and while face shields are an acceptable alternative.
It's probably worth remembering as well that there are face shields on the market that don't meet the definition of face shields that either OHA or Oregon OSHA uses. The ones that basically just cover the nose and mouth. There's a very clear definition that says, forehead, below the chin, curve around the head. That's what we're talking about when we're talking about a face shield in this context. And so it will prevent some spread of a sneeze, although probably also it will need to be cleaned right away. So the next question is from Jolene asking if you have to wear a mask if you are outside speaking to someone. The short version is if you're within 6 feet, yes.
So again, it's about reducing the risk of getting the disease, getting the disease or transmitting the disease. So wearing face covering is a good idea.
And there's certainly nothing magic at 6 feet that says that the droplet vanishes, and so it's a significantly reduced risk at 8 feet, but it's not as though the risk goes away.
It doesn't go to zero. Very true. A question from Maria. Are businesses required to provide face coverings for employees and customers?
So businesses are not required to provide them for customers. The question of whether they're required for employees is one that could probably be argued, but our position is that since they are safety equipment, you should provide at least basic face coverings. But I'd let people wear their own as well, because one of the things is the value of comfort for anybody. And so if they're more comfortable wearing their own, I would certainly let them do that. As far as customers, While it's not required, I think that I would do two things if I had a retail business, and actually my wife does have a retail business. I would provide the lightweight disposable masks. I'd lay in a stock of those so that I can give them to a customer who's not otherwise able to, or not otherwise prepared to wear a mask. And frankly, I'd also keep a stock of face shields like this on that I could sanitize, but that I could loan to individuals who might actually have a bona fide difficulty with wearing a tight-fitting facial covering.
Last question from Josh. I've noticed a number of store employees who claim to have a medical exemption from wearing a mask. Given the restrictions, as they have been explained, do employees actually have the opportunity to completely forgo a mask?
So the answer to that question is no. But if they have a bona fide disability or medical issue, the employer has an obligation to engage with them about ways that that disability can be accommodated. And so that might mean that they end up still in the establishment, but at a greater distance. It might mean restricting their activities so that they're not actually engaged in public-facing activities, but they might be visible. But it certainly doesn't mean that they can simply say, I have a medical exemption, therefore I'm not wearing a mask and I'm going to expose other workers as well as customers to the risk that I have COVID-19. That is not an option.
Thank you very much for joining us. That's all the time we have for this conversation and this topic. Check out our website. We have more information. And stay safe, everyone.
Thank you. Stay safe and healthy.